everybody's favorite lab assistant with you for the gross anatomy of the muscular system. And you might be saying to yourself, that looks an awful lot like the professor. And I would say to you, I might be the professor acting as the assistant, but I can have as much attitude as I want right now. But I'm actually the assistant. Acting like I'm the professor, acting like the assistant. It's assistantception. I digress. What I'm gonna do is take you through these muscles here, and you'll notice the first thing here is cat muscle dissection. And I totally should have used this opportunity to bring home to the professor's house a full-size dissection tray and cat and dissection tools, but the professor's children may or may not be cat people. The professor might be too, but she doesn't. She's against new poopers. They're not new poopers, they're old poopers. The point is, people, professor might be a little anti-cat. I, the assistant, might take you out and find Mr. Mittens, point out some muscles on him. That was like a joke, but not a joke. I could like pet the cat and show you approximately where these muscles were. I would not dissect the cat, my cat, on camera ever. Never. I wouldn't dissect my cat off camera ever. The only cats I had to ever dissect are already dead. We get them from Fisher Scientific, and it's all legit and ethical, allegedly. I don't know. I teach the classes. I cut up the cats. I suspend the disbelief. I digress a whole lot of times. That's mostly the professor. I'm mostly on target. Not tonight, apparently. So what I was thinking I would do for these models is take you through each model that has each muscle. Because as you'll see back here, we've got like an arm. And we have like our female muscle model. We're gonna call her Andrea. And then we have our male muscle model. We're gonna call him Thomas. So, this is the assistant here with you. And I decided, without consulting the professor, that I was going to make you look at these bones that aren't on the bone lab, but they should have been in your ear lab, and they weren't because somebody forgot that they brought them home. These are the smallest bones in the body, the auditory ossicles. And so maybe it'll be a bonus station or something. Where is that camera? What's that like? Is that my flash from the camera? Yes. Again, here we see the problems of not having a cameraman, a lighting crew. Malleus, incus, my favorite, stapes. We're on the skeletal system, right? And the bones, might as well look at some, not blood vessels, some bones. And now let's look at some muscles. Here we go. Head, muscles of mastication, temporalis, masseter. Temporalis, masseter, temporalis. Masseter's taken off on that side. Okay. Masseter, temporalis, masseter, temporalis. Wonderful. Masseter, temporalis. Okay. Sternocleidomastoid. That was a muscle of the day. So you can look at it right there. Oh, should we be talking about all of their actions? Elevates mandible. What does that mean? That if you've got your jaw like this, depressed, temporalis and masseter, elevate it. Great. All right. Sternocleidomastoid. Oh, this isn't lecture. This is lab, and I'm the assistant, so I am gonna talk to you about all of it. Show you. Okay, sternocleidomastoid. Turns head to the opposite side, one side. Flexes head, both sides. Turns head to the opposite side, one side. What does that mean? That if my right one pulls, I'm gonna turn my head left. Why? Because here are my origins, sternocleido, inserting on my mastoid process. So when I shorten, I grab the mastoid process and I turn my head to the opposite side. Now, if both of them contract, I grab both mastoid processes and I flex my head. Got it? Good. Sure, let's look at them over here first. Do we have them on the other model? I don't think I do. Trapezius. Elevates and depresses shoulder, extends head. Trapezius. One of my favorites, this bad boy right here. Okay, elevates, depresses shoulder, and if your head is flexed, extends your head. Brilliant. That arm was not supposed to come off then. Not elegant. Trapezius. I think we can see it there. Okay, deltoid. Muscle of the day, right here. What does it do? Oh, the medial fibers abduct the arm. The anterior fibers, oh, flex the arm. Posterior fibers extend the arm. Deltoid, deltoid, deltoid. Oh, don't fall over, muscle head. Ah! Deltoid. Deltoid. Great. Abduct, flex. Oh! Don't even stop. Okay, latissimus dorsi. Stop dropping things. Stop gravity. Stop everything. Your lats right here. So, yeah, these are the ones that you actually, like, if you're doing a wheelbarrow and moving like 3 tons of sand, you gotta like activate your lats to stabilize that wheelbarrow. And that was hard for me to understand. What are the latissimus dorsi? Dorsi, dorsal side, latissimus. Latissimus, latissimus. Extends, adducts, and rotates arm. So it actually comes up in here and inserts in the humerus and is going to help with extending. So that would be like pulling back and adducting, oh, pulling back toward, and rotating the arm. And so how does it do that, and how does it help with the wheelbarrow? Well, it just does, because it stabilizes your humerus. So be aware of that. Terry's, can we see it over here? Any at all? Oh, no, just ignore that. Terry's, if we look on here, Terry's major, extends, adducts, and rotates arm. We can see that right here. Right here, right here. Terry's minor's above it, and it's part of the rotator cuff. Okay, so Terry's major is the easiest one to see there. Okay. Okay, cool. Pectoralis major. You've probably all heard of good pecs. Pectoralis major. Right there, right there. Okay. Stop falling off, arm. It's not gonna do it. Pectoralis major. Flexes, adducts, and rotates the arm. What does flexing mean? What are we talking about, arm? That arm doesn't move at all. Oh, these arms move. What am I doing? I'm getting over it. Here we go. Pectoralis minor is deep to pectoralis major. Ooh, ooh, we can pull off your chest. That's amazing. Can we see pectoralis? No. Pectoralis minor. Right here. Everything's falling apart. I don't have the patience anymore. I'm so tired. It's late. Stop whining, assistant. You don't get paid enough to whine. Serratus anterior. Okay, wait. You didn't tell us what the pectoralis minor does. Read it. Okay, I'll tell you. Pectoralis minor depresses your shoulder. How? Because your shoulder's this whole thing here, and so I can pull it down. Okay, serratus anterior. This one looks like a serrated knife. Serratus anterior. And it is going to help to rotate your scapula upward and helps with elevation and depression of the scapula. Why? Oh, look at that. Because it's beautiful and ginormous. Ba-dang dang. Okay, rotator cuff. Rotator cuff is, I mean, going to be on all the models, but let's just talk about it here. These 4 muscles that help to rotate the glenohumeral joint. So here, we have our supraspinatus, and this is actually going to be the muscle that initiates arm abduction. The primary abductor is going to be this bad boy, which is who? Deltoid. So, but we're going to get it started with supraspinatus. Supra above spine of what? Scapula. Supra above the spine of the scapula, supraspinatus. Okay, then right below it is infraspinatus, and then teres minor here. Infraspinatus is going to help with rotation and adduction of the arm. Teres minor rotates and rotates and extends the arm. And then, in order to see the last rotator cuff muscle, you have to move your lab jacket, I don't know, glare blocker out of the way. And under here in the subscapular fossa of what? We have subscapularis, the last muscle of the rotator cuff, and it helps to rotate the scapula upward. Okay, so here we have the subscapularis, and it helps to rotate the arm medially, and all of those muscles make up your rotator cuff. When we get down to the arm, here's our biceps brachii. It is the forearm flexor, so it contracts and flexes your forearm. Brachialis is a synergist with that, and it's right here. This is brachialis, and it's deep to biceps brachii. Okay, cool, where are we at? Different page. Okay, so next, triceps brachii. Back here, these are our forearm extensors. Brachioradialis. So you can get a lot about a muscle from its name. Brachioradialis. It tells you it's coming from the brachial region and going to the radial region. So, brachioradialis. Okay, biceps brachii, brachialis, brachioradialis. Wunderbar. Where's the other arm? Right here. Okay, biceps brachii, right here. Brachialis right here. Thank you, Flash. So biceps brachii here, brachialis here, triceps brachii here, brachioradialis here. How can I tell that that's brachioradialis? Well, because my radius goes with my thumb, right? So there's my thumb, there's my radial region, there's my brachial region. That means this is brachioradialis. Okay, wonderful. What do we need next? Grouped flexors and grouped extensors. Okay, muscle head. Grouped flexors and grouped extensors. So there are a lot of muscles down in here that help with the flexion and extension of your fingers. And you're not going to have to know the individual names of everyone, except for pronator and supinator. So if I just put something like right here and ask you, what is this? You're going to say, oh, that's a grouped. What do you imagine it would do? If it shortens and we pull on a bone, it flexes. So that's one of the grouped flexors, which means, what are these back here? If it shortens and pulls on a bone, those are the grouped extensors. Okay, but you do need to know pronator teres and supinator. So here, this one right here is pronator teres. So if you imagine you're in anatomical position, okay, and that's when your hand is supinated. Right? Well, there's a muscle deep in here called supinator we're going to look at that does that. But if I'm supinated and I want to pronate, then I could contract that bad boy right there and pronate my forearm and hand. Now, if I was pronated and I wanted to supinate, then supinator is... this bad boy right here, okay? So that if I'm pronated, I could contract that and pull my hand back and supinate. Okay, supinator. And did you notice how it was deep to some muscles? What muscles were those? The grouped extensors. Great job. Okay, next we have our muscles of respiration, the external and internal intercostals, and the respiratory diaphragm. So as far as the diaphragm goes, that's this big muscle here that flattens during inspiration. And the external intercostals, okay, so, all right. So one of the ways that you're going to know external versus internal for both your intercostals and your obliques is the orientation of the muscle fibers. And I learned it with my abdominal obliques, which are down further and by where you would have pockets. So if you're going outside and you're cold, you put your hands in your pockets, right? So the muscle fibers of your external obliques and your external intercostals, which is what we're really talking about right now, go this way, okay? And then the internal ones, just flip your hands, and that's the way their muscle fibers go. So both obliques and intercostals. So if we look right here, we can see intercostal, inter, between the ribs, costal. So we have muscle fibers going this way, and we have muscle fibers going that way. So I just told you, if you are going outside, you're gonna put your fingers, your hands in your pockets, and so your muscle fibers will go this way, right? So which are these? Those are the external, right? And then you flip your fingers, look, those are the internal. I wish your hand was like better. Oh, here we go. This arm's got it. We'll do it over here. Okay, we're not gonna be upset, we're gonna move on. See, now we're down to our abdomen. What do we have? External obliques, internal obliques, transversus abdominis, rectus abdominis. 4 muscles that are part of your abdominal wall. They all help to compress your abdomen. What does that mean? Well, they squash your guts in. And let me tell you people, that's important. Or it's huge. Before my wedding, which is, you know, the marriage and divorce has already happened, but before my wedding I decided to get down to essential body fat. So I worked out like a maniac, and it got to the point where my abs were so developed that if I ate a big meal in here, it pushed on my muscles out here. So it hurt to eat too much because my muscles were too solid. So why am I telling you that? They're not that solid anymore. I wish they were, but I'm telling you that because look, a function of all of your abdominal muscle. I wish that my lingual muscles were working better. A function of all of your abdominal muscles is that they compress your abdomen. Oh. And rectus abdominis has the additional function of flexing your trunk. What does it mean if I flex my trunk? It would mean that I were to decrease the angle here. Flex it. So these muscles right here, if they tighten, they could flex my trunk because those muscles are the rectus abdominis muscles, okay? So the 6-pack or 8-pack or 12-pack or 28-pack, whatever it is you got going on down there, that's happening because of our rectus abdominis muscles. Okay, internal and external obliques. Again, we just talked about the way that muscle fibers go. So if I'm outside and I'm going out in the cold, my fingers go this way. Those are my external obliques. If I flip my fingers, do they only have... This bad boy only has external obliques. Okay, so here we go. If I go outside in the cold and I put my hands in my pockets, then those are my external obliques. And if I flip them, so here's my hand in my pocket on this side, right? And I flip it, that's my internal oblique. This is my rectus abdominis, external oblique. And transversus abdominis is right here. Transversus, brilliant. Pelvic diaphragm. Do I have a model that has it? Ooh, Alex, do you have your pelvic diaphragm? That's what she said. Oh yeah, right there. See that muscle? Pelvic diaphragm. Why is that gonna matter? Well, because next semester in 202 we're gonna talk about like, pelvic diaphragm. Lady, that's not the pelvic diaphragm. That is the penis right there. So that muscle right there is the pelvic diaphragm. And yeah, so like you'll see coming through the pelvic diaphragm is the membranous part of the urethra, which then leads into the other part of the urethra, which is what we were looking at to begin with. It's okay, I'm just the assistant, so I'm allowed to be ridiculously silly. And what does it do? It supports and raises the pelvic floor. Hip, gluteus maximus, gluteus medius, gluteus minimus. Gluteus maximus is really easy. Gluteus medius is on the back of it, and it's not really great on a bunch of models. Okay, gluteus maximus. Gluteus medius is deep to it. Whose butt comes off? Yours does. Gluteus maximus, gluteus medius, gluteus minimus. Okay, gluteus maximus, gluteus medius, gluteus minimus. Okay, and what do they do? Gluteus maximus extends and rotates thigh. What does that mean? Well, if my thigh is flexed, then my leg would be up, and gluteus maximus extends it, okay? And it helps to rotate it. Gluteus medius abducts, so when I contract that, I move my lower limb away from the midline and rotates the thigh. Gluteus minimus abducts and rotates the thigh. Wonderful, we're almost done. Tensor fascia lata. I like this muscle a lot, actually, because this thing right here is like such a strong piece of dense regular connective tissue. If we were doing a cadaver lab, we would all be like grabbing it and trying with all our might to pull it, and nothing would happen because it's resisting so much tension in one direction. It's so strong. This is the IT band, or the iliotibial tract, and it's attached to this muscle, the tensor fascia lata. Okay, tensor fascia lata. All right. It helps with flexion and abduction of the thigh. Sartorius. You guys can look at this. I am so tired. Sartorius flexes and rotates thigh, flexes leg. Gracilis adducts leg, flexes thigh. Pectineus flexes and adducts thigh. Okay, iliopsoas flexes and rotates thigh. Okay, go through your lab guide and your book to make note cards and memorize this stuff. Why? Because I've already done it, and it's getting later and later, and I'm getting tireder and tireder and grumpier, and I'm allowed to because I'm just the assistant. So what I'm gonna do now is show you these muscles on the models that we'll be testing you on. I'm gonna take you over to that picture over there, and then I'm going to bed. Okay, so Sartorius. Crisscross applesauce muscle. It's a strap muscle. You've got two strap-like muscles you're going to recognize. What are you talking about, lady? Well, they're like strap-like and flat. Sartorius and gracilis are both strap-like. Sartorius is the one here at this angle. Gracilis is this bad boy right here, okay? So those are easy to recognize because they're really straight. So what you're going to do, I'm skipping ahead a little bit in the lab manual because next it says pectineus and iliopsoas, but I want to show you how to find adductor longus and adductor magnus based on gracilis. So gracilis is here. Magnus always means bigger as in wider. Longus always means bigger as in longer. So gracilis is going to be our marker. Sartorius is right here, these weird straight muscles that your weird assistant likes, okay? So gracilis is your medial muscle that you're looking at, and back here, posterior to it, is adductor magnus. This one in the front is adductor longus. So gracilis is going to give you the marker for those two adductor muscles. Guess what they do? They adduct. Pectineus is this bad boy right here. Iliopsoas is another one that might tragically be lost because I may not have brought home the right model. Dang it, all right to heck and back. Sartorius, gracilis, adductor longus, pectineus. Oh yay, we've got it. Iliopsoas. So this is the reason you're able to stand upright, is because you have all of these erector muscles that stand you up. And iliopsoas is coming from two muscles. And this is why if you look at different books, they can have a different count for muscles, how many muscles you have in your body. Because some books just call this iliacus and this psoas major, and that's it, so those are two muscles. But some books just call them iliopsoas and call it one muscle. So this is iliopsoas, and it's going to help to keep you standing erect. And so it's helping you to stand erect because it helps to flex and rotate your thigh. All right, let's come back here. What else do we have? Where are we? We did those. Okay, quadriceps femoris. Quadriceps femoris, the four muscles on the anterior compartment of the leg. So this is our rectus femoris, vastus medialis, vastus lateralis. Rectus femoris, vastus medialis, vastus lateralis. Deep to that, we have vastus intermedius. Come on, turkey. I'm not a turkey, I'm a human. Okay. Vastus, sorry, rectus femoris. Vastus intermedius. There, hamstrings, biceps femoris, right here, the most lateral attaching. Semimembranosus is the most medial attaching, and it's bigger, it's down here, and it's deep to semitendinosus. On top, leg, gastrocnemius, soleus is deep to it, right here. So gastrocnemius up here, soleus down here. Peroneus longus is also called fibularis longus, and it's right here. So that's peroneus longus. Tibialis anterior is right here. Oh look, there's your tibia. This is anterior, tibialis anterior. Then the other one that you need to know for your leg is the extensor digitorum longus. And this one you can find because it's got these tendons going out to the digits. So this is my extensor digitorum longus. So if I follow those tendons up, extensor digitorum longus, tibialis anterior, fibularis longus, which is also called peroneus longus, right here, soleus, gastrocnemius. Brilliant. That's page 6. That's it. That's it. These muscle mnemonics are more useful if you're doing the cat. And as we said, we're not dissecting Mr. Mittens. And so I would answer those questions if I were you. They're helpful. What muscle's that? That's your butt cheek, and you're probably sitting on it. I mean, pardon me, it's your gluteus maximus. And yeah, enjoy sitting on it. See you next time. See you next time right over here at this figure. What are all of the muscles on this model? I'm sorry, this figure that we can see that you have to be able to identify? What's that? Yeah, you're right. It's temporalis. What's that? Ooh, good job, master. Oh, what's that? Sternocleidomastoid. Ah, what's that? 150. Can you tell what that is? You're right, it's trapezius. What's 149? Scapula. Ooh, what's that? Deltoid. What's that? Pectoralis major. Okay, what's that? Biceps brachii. What's deep to it? Brachialis. Brachioradialis. Whoa. What's that? Oh, what are those? Grouped extensors. Okay, what's over here? Oh. Grouped flexors. Brachioradialis. Brilliant. So here we have pronator teres. Grouped extensors. Brachioradialis. Over here, grouped flexors. Do it that way. I don't know, I guess I can see triceps back there a little bit. And back there a little bit. What else do you need to know? I don't think we need to know anything else from the arms. Here in the chest, pectoralis major, pectoralis minor, serratus anterior. Oh, which intercostals are these? Those are, if your hand was here and you were putting it in your pockets, then those would be flipped this way. Those are the internal ones, which means that the external ones are right there, and then right there serratus anterior, pectoralis minor. I think we've done everything we needed on the arm, I think. And if not, well, we're not gonna complain too much about it because again, falling asleep on this side of the lab. Rectus abdominis. Which ones are these? If I'm standing outside and I'm putting my hand in my pockets, those are the external obliques, which means that, oh, if I flip my hands, those are my internal obliques. Ah, and look, there's transversus abdominis there. Okay, that's an aponeurosis. Okay, what do we have down here? Is that Mr. Mittens? Sorry, got distracted. Iliopsoas. Tensor fasciolata. Sartorius. Gracilis. What's that? Vastus intermedius. Vastus medialis. Vastus lateralis. Rectus femoris. What else do we need to know? Which is this? If this is gracilis, what's that? Adductor longus. So, iliopsoas, pectineus, adductor longus, gracilis. I think that's everything we can see there. Tibialis anterior, extensor digitorum longus, peroneus longus, back there, gastrocnemius. Is that soleus and gastrocnemius? Yes. So gastrocnemius is this bad boy right here. This is gastrocnemius, you can see right here. This is soleus that's deep to it, you can see right there. What else did you need to know? I think that's it, right? I don't know, whatever else you need to know, you can look at somewhere else. We're calling it good for tonight. Peace out.